Good afternoon, everybody. I'm excited to welcome you as the new employees to UMS. This is a pretty fantastic place to work. My name is Zain Fanek. I'm an occupational health specialist, and I have been asked to be part of your orientation today to talk to you about bloodborne pathogens and your risk as healthcare workers. I have been exactly in your shoes, and I know the new employee orientation can be long, and you have been in lectures all morning. So I will make this short and to the point as much as I can. Before I begin, I would like to make the disclaimer that I have no conflict of interest and that the following video is my final presentation for a class at UAMS and represents a hypothetical scenario. The following presentation does not necessarily reflect the views of UAMS or any other agent. I have here an overview of my presentation. We will start by discussing what bloodborne pathogens are. Then I will move on to talk about who is at risk of acquiring these infections and what the different modes of transmissions are. I will move on to discuss the risk of transmission if one is exposed to such pathogens at work. Then I will cover pre-exposure preventative methods as well as post-exposure management and treatment. So to start off, what are bloodborne pathogens? They are small organisms like bacteria or viruses that get carried in our blood and can cause us to get diseases. Many of these organisms have been identified and they are very familiar to us, such as malaria and syphilis. The most common of these pathogens that are transmitted at work are hepatitis B, hepatitis C, and human immunodeficiency virus, also known as HIV. All these three viruses are viruses that are carried in our blood and, as we all know, can cause us to have disease. We are familiar with how hepatitis B and hepatitis C can cause liver damage and increase the risk of getting liver cancer. HIV kills the fighter white blood cells that we have in our body that protect us from getting other diseases. This puts us at risk of getting more severe infections when exposed. Some of you might be more familiar with how these viruses are transmitted in the general population. Recently, there has been a lot of talk about how hepatitis C has increased due to the increase in needle sharing among drug users. What I will be focusing on today is occupational exposure, which puts you at risk of acquiring these viruses at work. So let's discuss which populations are affected by these bloodborne pathogens, specifically in the context of occupational exposure. As you have probably guessed by now, healthcare workers are among the affected population, as I have been asked here to talk to you today. According to the last set of statistics that I saw, we have 600,000 to 800,000 incidents of exposure to blood that are estimated among healthcare workers annually. That group includes anybody who comes into contact with the patients, such as physicians, nurses, technicians, and pharmacists. Really, anybody who gets exposed to any bodily fluids from the patients. The most common modes of transmission of these bloodborne pathogens are cutaneous and mucosal. Cutaneous indicates anything that crosses your skin barrier. For example, if you are working with needles or anything sharp, you have the risk of puncturing your own skin and allowing the patient's blood to enter your body via your skin. If you already have a cut in your skin, then you have the risk of the patient's blood directly entering that cut. Mucosal transmission means if the patient's blood splashes onto your mucosal surfaces, such as your eyes, your mouth, or your nose. And this is not limited to blood, but can also include other bodily fluids. For example, cerebrospinal fluid when you're doing a lumbar puncture, or synovial fluid if you're aspirating a joint, or vaginal secretions when you're doing a pelvic exam. These can all put you at risk of transmission of these pathogens. So I know that if I personally get infected, I will be freaking out to my doctor or to Google or to WebMD about what my risk is of getting these pathogens actually transmitted to me. So I wanted to give you a better idea of what your risk of infection is if you are exposed to bloodborne pathogens at work. I will be covering only the most common pathogens that we discussed. So hepatitis B, hepatitis C, and HIV. If you are exposed to hepatitis B, but you have been vaccinated, then you do not have a risk of infection. If you are not vaccinated, then your risk of infection is anywhere between 6 and 30%. And this will depend on how infectious the patient is that you came into contact with. For hepatitis C, we do not have a vaccine yet, unlike hepatitis B. And the risk of infection post-exposure is around 1.8%. If you are exposed to HIV cutaneously, then the risk of infection is around 0.3%. And if you are exposed to it mucosally, then your risk of infection is around 0.1%. As with everything, prevention is better than treatment. The U.S. Occupational Safety and Health Administration put forth guidelines for institutions to ensure employee safety. For example, UMS is required to use safe equipment so it can reduce the risk of injury among its employees and its patients, such as using the retractable needles when you are drawing blood from a patient. So let's say you're a technician, you go see your patient in the morning. The needle that you use to get blood from your patient immediately retracts after you are finished. And that way, the risk of you puncturing your finger, for example, with that needle is much smaller than it would be otherwise. As part of your orientation, you are also required to complete the occupational health and safety training. The information for this will be included in your packet that you've been handed for the new employee orientation. There are things that you can also do personally to reduce the risk of transmission. So, for example, before entering a patient's room, make sure to pay attention to the precautions that they have on their door. So, if it says this patient has respiratory precautions, then you are required to wear a mask, gloves, and a gown so you do not get any of the droplets on your body. And if the patient is under contact precautions, then you are required to wear gloves and a gown when you are coming into contact with this patient. And as a general rule, when you are dealing with blood or bodily fluids, then you should be wearing gloves and masks to reduce your risk of exposure. And of course, if you have any cuts on your skin, then you should make sure that all of this is covered up, whether it's by band-aids or wearing gloves. And as always, dispose of needles and sharps in the red sharps containers, which we have almost everywhere around the hospital. So these are just general things that you can do to reduce your risk of infection when you are coming into contact with a patient. And that could be regardless of how long you are in contact with them. So if you do, let's say you do come into contact with a person's bodily fluid, then these are some of the things that you can immediately do after exposure. So if the exposure was via skin puncture with a needle stick, then you need to thoroughly wash that area with soap and water. And for a mucosal exposure to the nose or the mouth, then make sure that you flush out that area the best that you can. And if you get any splashes into your eye, then you basically get to do what this guy is doing on the picture on the right, which is to thoroughly rinse your eyes with clean water, saline, or sterile irrigants. And we do have some eye washing stations around the hospital as well, such as the one in this photo. And I know that some of us get the urge to squeeze out the wound to get the blood out, but there's actually no evidence that squeezing the wound will reduce the risk of transmission. And UMS has put forth specific steps that you should follow for after an exposure. And the first step that they recommend is to get evaluated as soon as possible at the employee health clinic or the emergency department. And I will have numbers for both of these in the last slide of my presentation so you can keep them for later use. You are also required to complete an employee student um, injury form, injury and incident report form, and that is also included. The link to it is included in your packet as well. And lastly, UMS requires you to call the company nurse injury hotline, and this is the number for it. So I would recommend saving it for later as well. So let's say that you are exposed and you go to the employee clinical services. Then this is kind of what you can expect in terms of treatment that they will offer you after you go to see them and get evaluated. Again, I'll be using the three most common organisms that we covered, which is Hep B, Hep C, and HIV. And if you are vaccinated against hepatitis B, then there will be no treatment required after you have been exposed to that. However, if you are unvaccinated, then the treatment will consist of hepatitis B immune globulin and or hepatitis B vaccine. For hepatitis C, as we talked about not having a vaccination, and we also do not have post-exposure prophylaxis, which has been recommended yet, which exactly for this case is why we always recommend prevention. There is post-exposure prophylaxis that is available for HIV, and the treatment for this is recommended within the first 72 hours post-exposure, and it will last for about 4 weeks, and it will be made up of different antiviral drugs. This will be depending on what your physician recommends. So, just to summarize, as healthcare workers, we are exposed to all types of bugs, and you are in close contact with your patients all the time, which increases your risk of transmission of bloodborne pathogens. As we discussed, the most common pathogens that are transmitted include HIV, Hep B, and hepatitis C. Primary prevention via using safety precautions and getting vaccinated are the most important steps that you can take in reducing the risk of getting infected. If you do get exposed to Hep B or HIV, then there are post exposure prophylaxis that are available. However, there is currently no approved post exposure prophylaxis for hepatitis C, which again is why we recommend prevention, prevention, prevention. As promised, that was pretty short. So, what questions can I answer for you? Here is a list of the references that I used in creating this presentation. And here is my contact information in case you think of any questions later. I know I'm the type of person who can't think of questions on the spot. I also included the numbers to our employee health services that you can call in case of exposure to a patient's blood or bodily fluids. We have two clinics and they both operate only during regular work hours. So as you can see here from 7 to 3:30 and from 8 to 4:30, I would recommend keeping these numbers in your phone just in case. In case of exposure after hours, then you can go to the emergency department or call the number that I provided for them here. Thank you so much for your attention. And again, welcome to UMS. I will stay around for a little bit if somebody has any questions afterwards. Thank you.